We're here with Dr. Josh Friedman of addent at the American Dental Association meeting in San Francisco. And we're looking at a new form of polymerizing composites. Now, Josh, what is thermal light polymerization?
The act of heating composite will improve its physical characteristics. You know, George, in the laboratory we've heated composites for years.
Yes.
And this has not been done in the mouth until we developed the idea of using it at a lower temperature for this particular purpose. We speed up the chemical reaction and we improve the physical properties.
Well, that's what labs have been using heating of composites for at least 20 years.
Exactly, and they're using a much higher temperature. They're using about 160 degrees Fahrenheit, and we're using 130 to 140 degrees Fahrenheit.
Which is, of course, comfortable. And
very comfortable. We have pulp studies to show that it has absolutely no effect. In fact, the effect of that temperature is less than that of curing light at high output.
Really?
Yeah.
I've been polymerizing composites for years. How does thermally treating them before polymerization help me at all?
Well, it gives you three benefits. Heating composite will cause it to flow 68 to 70% faster. It will improve the depth of cure by up to 80%, and it will improve the bottom hardness of the restoration as well. We have research to show all three of these effects, and more research to come.
Great. How does thermal assisting influence the flow rate of the composite?
Okay, well, we have several studies to show this, George. One study by Fred Ruderberg at the University of Georgia showed up to 68% improved or decreased film thickness, which is directly related to flow. We have another study by Jim Broom at the University of Alabama to show similar results.
Now, this means that we're taking microhybrid composite with all its wonderful properties and inducing it to flow more readily into the cavity preparation.
Exactly. And the advantage of that is that we're making the composite act more like a flowable and eliminating the need for the use of a flowable.
I'm fascinated by the idea that I could possibly reduce my curing time by thermally assisting the whole process. How does that work?
Well, as you know, any chemical reaction can be speeded up with heat.
Yes.
A study done by Jeff Stansbury at the University of Colorado, soon to be published in the Journal of Dental Materials, showed that you can get up to 80% less to cure. It takes you up to 80% less time to cure to the same degree of polymerization. And that's a fantastic effect because coupled with that, we also see greater depth of cure.
So in other words, I can cut up to 80% of my curing time. That saves me a lot of time.
It saves you a lot of time, and what it does also, it doesn't really depend on which light you use. Once you warm your material, whether you have a weak light or a small or a powerful light, the results come out about the same. It looks like it takes us about 11 seconds to cure a 2mm layer with most materials with just about all the lights that are on the market.
Fantastic. Now, you mentioned the depth of cure was affected as well.
Well, that was a study done by Dr. Ivo Krejci at the University of Geneva in Switzerland that showed that the bottom hardness of these various materials are also improved by the use of heat and, in fact, increasing the depth of cure.
So as I'm curing, I not only am secure about curing the top layer, which is closest to the light, but I'm secure about curing the bottom layer, which is far away and which I can never actually see or feel.
Exactly. So there's a lot of benefits for the dentist.
I've heard recent rumors about the fact that there are micro-leakage benefits to thermally assisting the light cure process.
Yes, George, I'm glad you mentioned that. There's been a study at the University of Detroit by Dr. Anne-Marie Nimi, which will be presented at the forthcoming AADR. And that study showed that we have less micro-leakage when we use a heated composite as opposed to either a normal composite or composite that's been layered with a flowable underneath. As you know, a flowable will shrink at a much higher rate than a normal composite. So by heating the material and getting good adaptation, we get the advantages of the flowable, but we don't have the disadvantages of the shrinkage.
So all the strengths of the microhybrid right up to the margin with a better seal.
Exactly.
Now, how can I apply this kind of technique to my own practice?
Well, it's very simple. Right now, most dentists use flowables with the idea that they're going to adapt better to their floor of the cavity and to their margins. This would just eliminate the need to do that, and that's just one less step the dentist has to be concerned about.
So in other words, it makes my life easier and better. My procedure is faster.
Exactly.
Sounds wonderful.
Thank you.
Assuming that I have the CalSet unit, which I do, and I use it on a regular basis, are there any other techniques that I can adapt to this heating process?
Well, there is. In fact, we have a bleaching tray that is used to warm bleach material. As you know, dentists are currently using lights to warm material, and now with the same device, they can use it to warm their bleach and get a faster and better whitening effect. What we have here are two different trays. This is our standard tray, where you can put compules or dispense material, and these are our new dispenser gun trays. So while the material is in the dispenser gun, we can keep it warm and then go back and forth from the mouth and have the material still benefit in that way.
Well, these products look like they'll really warm up my composite technology.
We hope that's going to be the case, and we're looking forward to some great acceptance with this new technique.
In fact, they make our procedures better and easier, and therefore faster. It really sounds wonderful. Thank you, Josh.
Thank you. Well, this is our standard tray with the compules placed in position, and here we have some composite in the center well, which can be dispensed from a syringe. That's one way to use the device. The other way is to place a compule in the device, as we have here. And of course we have a cover to keep the material warm as well as block it from the light. And then we have the new trays, which are exciting because we can keep the composite in the syringe as we have here, and then it stays warm in between applications. These are designed so that they'll fit various syringes of different manufacturers. And so here we see a caulk syringe, Kerr syringe, 3M syringe, and it'll just about do all the ones that are commonly used today with the same speed and efficiency. It just makes the whole job a lot easier.